Hi, Dr. Gay. How's your week been?
Hi, Doc. I'm all right. And how are you?
I'm good.
My week has been okay since I knew that you were going to take the hot seat today. Yeah.
Is it? Okay.
I was chilled.
But yeah, today's a very exciting episode. So yeah, I'm happy to be here, and joining us today is somebody who has joined us previously, and she's talking to us and chatting to us about epilepsy and seizure. Joining us today, we have Dr. Dimakatso Makwela. It's good to have you here.
Thank you for having me.
Good to. So how's your week been?
Oh, it's been okay. I'm excited to come on the show again and speak about epilepsy, a very important topic.
Yes, yes. And for everybody out there, you might be asking yourself, why epilepsy and seizures? And just to contextualize that, you know, epilepsy is one of the most common conditions, neurological conditions that we see. And we are really grateful to have Dr. Makwela here to just kind of debrief for us and chat to us about what epilepsy is. So what is epilepsy and how does it differ from, let's say, a seizure?
Very important question, thank you. A seizure is a symptom of epilepsy, but not all seizures are epilepsy.
Okay.
So epilepsy, and the name epilepsy, is only reserved where there's unprovoked seizures and recurrent seizures. So a single seizure does not make the diagnosis of epilepsy.
Okay.
So there are classifications as to who is going to meet the criteria to be diagnosed with epilepsy. But seizures are merely a symptom. Seizures can happen because there are problems in the body. So they can be a symptom of a lot happening in the body, and for that reason they don't always meet the diagnosis of epilepsy. With epilepsy, you want it to be unprovoked seizures, recurrent seizures, or even what is called an epilepsy syndrome.
Okay, okay. So when you're talking about unprovoked, you're talking about there's no underlying condition that obviously triggered potentially the seizures and the epilepsy.
Yes, so problems in the body, metabolic reasons, a low glucose or sugar level in the body, a very high sugar level, also extremes even with sodium and salt in the body, problems with the kidneys, problems with the liver not doing its job and clearing out toxins, or even infections like meningitis. There's so many reasons why a seizure can happen, so which is why I say a seizure is merely a symptom of something happening. So when there's none of that, when there's no underlying medical reason why the seizure will have happened, and it's recurring, then we can have a diagnosis of epilepsy.
Of epilepsy. Okay, no, that's very interesting and also very important to kind of understand, because I mean, we've heard in our communities, we've seen seizures happening, and often people are labeled as or diagnosed as epileptic when really it was just an isolated seizure event. And so what potentially could be, you know, so you mentioned unprovoked. So what things could lead to seizures happening over and above it being a symptom that could lead up to a diagnosis of epilepsy?
So the provoked ones, is that what the question is about? Okay.
Yeah.
So if you have, so the body requires for there to always be homeostasis, which is a balance of things.
Okay.
So when you have too much or too little of a certain thing, it can be a problem, and the brain is one of those that are very sensitive to changes within the body. Even a simple thing like temperature, a very high temperature, especially in children, and fever can result in what's called febrile seizure. So even just a simple change in high temp, that can result in fever. Dehydration, which leads to imbalances in salts within the body itself, can lead the brain to be having a seizure. A problem with oxygenation, very low oxygenation or hypoxia, leads to seizures. Sugar and glucose, which is the only nutrient that the brain really requires, if it goes too low or too high, that can lead to seizures, and many other things essentially, like especially things related to functions of the kidneys and the liver. If they're not balancing certain things within the body nicely, that can lead to seizures.
Yeah.
Through you, Doc. The manifestation of a seizure, maybe we assume everyone understands what the seizure is. What's the most striking manifestation?
Seizures can be very vast and different. the obvious ones that people will know is of a person falling down, frothing at the mouth, legs and arms making jerking movements. They may bite themselves in the mouth, or even end up peeing on themselves, like with urinary incontinence. That is a description of that fits what is more, a generalized tonic-clonic seizure. So when it's happening, the person is unconscious, will not know the event itself unless someone tells them what was happening to them. They wake up with a brief period of amnesia, not knowing what's been happening even before the event happened, and may wake up confused with headaches and body aches. That is essentially what a generalized tonic-clonic seizure would appear like. There are others where a person, other generalized forms of seizures that are just atonic, so you just lose muscle tone. If standing, it's mostly going to happen in the legs. You get what is called a seizure drop or drop attack, something like that. It can be absent seizures where there's no loss of consciousness, or well, there is loss of consciousness, but no falling, no jerking. A person just stares or blinks, lip smacking. Very common disorder in children, can happen over 100 times in a day, lasting about 30 seconds. So imagine a child in school, there's no falling happening, but the child is unaware what's happening in the class because they keep having these recurring seizures, and other people aren't aware that there's a seizure happening. There's also other ones where the person can have one part of the body involved, like an arm or part of the face or the leg, called focal seizures. And awareness may be maintained throughout all of that, and the person only notices the arm or the leg jerking uncontrollably. It's involuntary. And then others, while it's one part of the body that's jerking, but they also involve or evoke certain feelings that are abnormal. Like you can feel completely confused, or even a feeling of deja vu, smelling things, tasting things that aren't there. And they can be that difficult to know that what you've been experiencing is actually a seizure. And how would we know? Is to know and do tests that look at electrical waves in patterns in the brain, because that's the only way you're going to diagnose what has been happening as a seizure, especially if it's not the typical one that you're used to seeing.
Okay. Thank you. And so so it's quite vast, and maybe a lot of us haven't had the opportunity to notice seizures other than the generalized tonic-clonic, where there's vigorous shaking, and we might miss it. Just to take it back just a little bit, so what things predispose one to be epileptic? It's unprovoked, so surely there must be some sort of predisposing sort of factors.
So a lot of what is called primary epilepsy disorders are inherited epilepsies.
Okay.
Most of them will start in childhood, and they form exactly what is meant by epilepsy syndrome. Certain things will happen to a child, and they form specific wave patterns on that electrical brain electrical system, like I was explaining earlier, and they're very predictable in how they happen.
Okay.
So they can be inherited, and a lot of family members will be affected by it. Although sometimes you'll find that a parent may have had seizures manifesting in one particular way, but in the following generation it changes in the pattern or how it occurs. And there's many reasons why that can happen. When there's medication on board, seizures can change in character and all of that. So the primary epilepsy disorders, yes, those are one group of unprovoked seizures that can happen. Sometimes people just develop seizures for like a reason can never be found why. You look and do all sorts of testing, you don't know, but the person has recurring seizures, they need medication, they fit the classification, yes.
Of epilepsy. So in as much as they're unprovoked, sometimes you don't really have clear predisposing factors for why someone can be epileptic. And at the start of the conversation, I mentioned how it's a very common condition, neurological condition. How common is it in our communities, you know, where maybe people aren't as aware? And yeah, how does one get to understand better and raise awareness about the condition?
Epilepsy is very common, yes. World Health Organization says it's more than 50 million or so people worldwide with the condition.
Mm.
The sad thing is that the huge disease burden exists in low-income countries where people aren't even getting help. So the people living out there with seizures, they recur, everybody's just accepted that's the situation. This person will have seizures on and off. And then in South Africa, our stats coming out of Epilepsy SA, which is an organization that cares for people with epilepsy, it's an NPO, it says about 1 in 100 people in South Africa live with epilepsy.
It's quite common.
It's very common, yes.
Yeah.
So was there a relation to socioeconomic situations?
Yes, definitely. Much as we're saying that there are reasons to have unprovoked seizures, there are also seizures coming out of injuries on the brain, injuries related to birth and birth traumas, maternal health care, and problems that can occur within a pregnancy that affect the developing fetus, infections like meningitis or other infectious problems, and even head injuries.
While you're speaking of pregnancy, is it not one of the manifestations of fetal alcohol syndrome?
It is, yes, definitely, it is. And a lot of intrauterine infections will lead to damage on the baby, and they can lead to problems with epilepsy after birth and going on for long term in life. And the care that people receive when giving birth as well. That's a very important reason to have epilepsy and brain injuries in a child. If a child or if a mother has protracted labor or labor that needs assistance and isn't getting assistance in time, lack of oxygen on the child results in brain injuries. And those brain injuries may be a reason then for a baby to live lifelong with epilepsy. And cerebral palsy and epilepsy.
No, that's quite important. I think, you know, always when you think about developmental goals, maternal and childhood mortality rates are really important, and they're very linked to antenatal care, and, you know, everything feeds into that. But now, once we've spoken about the signs and symptoms potentially that one needs to look out for, what can I do at home if I now recognize potentially that a family member or a friend is having a seizure, or what can I do?
So in a case of a person developing a seizure first time, they need to be checked to know why. Since we're talking about seizures can be provoked by this and that, they need to be seen by a healthcare provider. There needs to be an examination and test that go into trying to find the reason why. Okay, in a person who is known with a diagnosis of epilepsy and is on medication, they can have breakthrough seizures, and if seizures happen once off, it's under a few minutes, under a minute, all that needs to be done is to make sure the person is taking their medication. This is reported that despite medication, seizures are ongoing, and then we can see how the healthcare provider can try and help in trying to make the control of the seizures better.
Okay.
Where a seizure itself is lasting over 5 minutes, that needs to be seen in hospital regardless, or seizures that come and there's a short brief period of quietness but recurs again over and over again, that person needs to be taken to the emergency room. So for a simple seizure that will be like in under seconds, and for people who are not used to seeing a person or they're not used to seeing a person have a seizure, those few seconds feel like minutes, and it's important to be timed. A person will come and say the seizure lasted 20 minutes. However, if you were to time it, you find it lasted 45 seconds. It can be traumatic to watch that. It feels like it's a long period that you were watching the seizure happen. So in those times, we ask time it so that you can report it nicely when you are with your doctor, and nothing you can do will stop the seizure. Okay, all you need to do is to make sure the person is safe while having the seizure. They're not hurting themselves. Okay, so a person can be fitting in a swimming pool, they're going to drown, so get them out of the pool. For example, people fit and fall into open fires, so they need help getting out of that situation. They cannot do it for themselves. Lay a person on their side, okay? On their side. If you have a pillow, you can put it under their head. There's absolutely nothing physical you can do to stop a seizure. So nothing, absolutely nothing in the mouth. There are people who think that you can put an object in the mouth to stop a person from biting their tongue. But that has been proven that you can cause more harm, because whatever you put in the mouth can injure the mouth and the palate, cause bleeding, or even by itself be a reason to obstruct the airway.
Oh.
So if you lay a person on the side, their tongue will not block their airway, and they can breathe. If ever they vomit because of the seizure, the vomitus or whatever secretions they have will flow out of the mouth as long as they're lying on the side. So it's best to just lie them on their side, make sure there's nothing around them that's harming them, and wait for the seizure to run its course. Because without medication or injectable medication, you can't stop a seizure,
Stop the seizure
when it's happening.
when
yes.
it's happening.
Mm.
No, that's very insightful. Dr. K, any questions that we've made, people who are interested on what epilepsy is and what?
Yes, Doc has answered a few of our social media questions already. Like the one about the object in the mouth, it's the most common. And the trauma that one suffers when you are witnessing someone around you having a seizure. I mean, it happened in class. It would make the whole class stand up. And that causes more, I believe it causes more commotion.
Yes,
And the person having a seizure is not going to have it any easier.
of course, yes.
Yeah.
So people are known to pin a person down when they're having a seizure. So like we've explained now, a person who's having a generalized tonic-clonic seizure, they'll wake up confused. They don't know where they are when immediately on waking up. They don't know what's been happening before. So now when that person wakes up, wants to look around and there's people pinning them down,
Yeah.
and then they start trying to fight themselves, like push people away. It
Yeah.
looks like they're fighting, and there can be a whole lot of drama around that situation. But the issue is to know that there is absolutely no need to be pinning a person down. It actually even hurts them more. There's all of that vigorous muscle activation happening. Pinning them down actually causes more damage because the muscles aren't free to move as they would. Okay, and then also it just literally makes them more confused as they wake up. It feels like someone's been fighting them because they're waking up and there's pain and there's people pinning. It feels to them like there's a fight, and their response will be to fight back. And then that's completely unhelpful. So it's better not to be
Dramatic
about it, yes.
And no objects in the mouth, guys.
No objects in the mouth.
I remember in class they used to stick a ruler, and now that you know, like now that you mention it, bleeding of the palate can actually lead to aspiration.
Exactly.
Yeah, and if there's vomitus, then there's more drama,
There's more drama.
Safety first, I guess.
Exactly.
Yeah.
And knocking teeth out because you put something and they bite it or whatever. And the worst you can do is to put your finger in there.
Yes.
If the bite gets so strong that it can literally chop the finger off. So
and they aspirate it.
of course, yeah. So nobody should put their finger into the mouth of anybody that's fitting.
Okay. Do children outgrow their epilepsy? That's a question from social media.
So the epilepsies that are called primary and generalized epilepsies, the inherited ones, usually by the time children get to adolescence, by 12, 16, those seizures can be outgrown. Yes. So that's very much possible. However, if you have seizures that are as a result of injury on the brain, that's a different matter altogether, where we can identify the structural damage on the brain or even a problem with the development of the brain. Seizures resulting because there was some issue on the brain itself. Those are unlikely that the person can outgrow them. Yeah.
Another question on social media related to children, I suppose a teenager. A person has a teenager who's epileptic. They are concerned about what kind of a life awaits them, what kind of careers can they get into. Is there even such a thing that they should be, what kind of careers should they avoid, I suppose? You can't be a sound engineer or you can't work with lights.
Construction also, maybe, yeah.
So a person with epilepsy should be aimed to have a normal life.
Okay.
Without restrictions. Obviously, all of that depends on how well controlled their epilepsy is. Okay. So I have found that in our communities, people accept that someone will have a seizure once in a month or twice in a month, that is wrong. We should be aiming for absolutely no seizures. You should have people who are on medication and they are well controlled, whereby they themselves do not even remember the last time a seizure occurred, for as long as they're on medication. So we should, all of us, be aiming towards that kind of control in epilepsy, and then have people who are completely functional and productive, can lead absolutely normal life, or whatever is deemed to be normal. So a child should be helped to reach their full potential. The issue with carriers is that, yes, it is risky for anyone with epilepsy, because no one can predict when the next seizure will occur. To be climbing heights, ladders, and working on double-story buildings, that kind of thing. So the construction of having to go up a height, that's risky business. I know that there are restrictions in aviation. If you have a diagnosis of epilepsy, it may be that flying planes is out of reach for any person with epilepsy. And even sports, it can be limiting in, like, playing professional rugby, for instance, or something like that. But essentially, there's the rest of what you can do. Also, like an epilepsy syndrome, where a person has what is called photosensitive epilepsy. So any flashing lights and computer screens that are flashing can trigger seizures. So that is a no-no for them. But the rest of the carriers, it should be that it's you are well controlled enough to lead a healthy, normal, productive life. Yeah.
And just to interject here, I really like and appreciate what you just said about allowing people to lead their lives as normal as possible. There's often a myth, that epilepsy is a disability. And it leads to a lot of stigma in our communities sometimes. So I think it's very important, again, to take that message home and understand that you can do absolutely everything and anything that you wish to do. The key is to be controlled.
Yes.
Yes,
Yeah.
I like
That's
that.
true. Yeah. When it's controlled, and epilepsy, that is obviously not related with disability, because that's of physical disabilities. That's different.
That's different,
Yes.
yeah.
But a person who has seizures and their body is still, they are able-bodied, should still be able to do what other people do. It on its own should not end up being a reason to be called disabled.
Yeah.
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 So another social media question says they suffered head injuries, and the doctors told them that they were at risk of developing seizures in the future. Does that tie in with what you've been telling us?
Yes. So injuries on the brain, be it injuries from trauma or surgery, any operations on the brain, or even a stroke itself, because it leaves scar tissue behind. Whether you had an operation or it was as a result of injuries on the brain from trauma, in accidents or assaults or that kind of thing. Anywhere in the brain where there's a bit of scarring is going to disturb the normal electrical wave patterns that the brain naturally has. And that can be a spot where the trigger for seizures can come from. So yes, definitely yes, head injury is a risk for developing seizures.
Next question is from an adult that was recently diagnosed with epilepsy not so long ago, and they say they're finding it difficult coping. We don't have the rest of the details. I suppose even emotionally and psychologically it might affect you. But what's your best advice?
Yeah, so it is it's very reasonable and imaginable that a person can struggle with the diagnosis. First of all, understanding what the disease is and what you've been told before about it. That can add to the trauma, and it becomes a difficult thing to have to deal with. But essentially, people need to just treat it as any other chronic illness. There's an illness, you take medication. If the medication is right for you, so there is no one size fits all when it comes to epilepsy medication. Every person is individualized. The first choice in medication, how much dosing they need, whether they need more than one type of medication, all of that is individualized per person. So for as long as the right treatment is being given at the right amount and the person takes it as advised, when there's good control of the disease, there's absolutely nothing to be worried about. It is the same as having high blood pressure or other chronic illnesses. You manage it and control it. Unfortunately, it may be that there is absolutely no cure. You will only control it, and then in certain circumstances may end up with a breakthrough seizure. But if and when the people around you are educated as to know if this happens, what should they do and not do for you, then life carries on.
And one needs to be wary of hopelessness.
Exactly, yeah. The more hopelessness and stress there is, the worse the control is going to be, because stress is one of the reasons to end up with uncontrolled epilepsy.
So whatever happens, do not lose hope.
Yes.
And support is very important.
Yes, absolutely.
Yeah.
Absolutely.
So our two most favorite mitigating activities to everything, I suppose, exercise and diet.
That's important, yes. A healthy body, a healthy brain, everything works out better, okay? You cannot cure it, obviously, with just exercise alone, but the healthier you are, like we were explaining, well, I can explain now that your brain requires that there's good oxygen supply and nutritional supply, and it wants glucose and it wants oxygen. So you need a healthy heart. How do we get a healthy heart? Through exercise, okay? When it comes to diet, diet is a very important thing, because there is an entity of epilepsies that are difficult to control with medication. Even in the best of circumstances, you cannot control it. It's called treatment-resistant or refractory epilepsy. Diet can be a thing that can be used to go a long way in trying to control that. What's called ketogenic diet or modified Atkins is another name, where essentially you want to do low carbohydrates, high fat diet. For some reason that can control seizures. So it would need to be done. It's very difficult. It's a difficult diet, and the support of a dietitian is important in that, and the family as well, to know how to feed the child or the person who's involved or who needs that. It can be very difficult and strenuous to try and stick to the diet. But diet, yes, can be used to try and control seizures.
Does sugar have an adverse effect on the condition? Excess sugar?
Not necessarily. If your body is of, well, obviously, like we were saying earlier, everything in moderation when it comes to the brain. A high sugar level can be a problem, but that is in people where their body does not know how to manage sugar, like in diabetics. And a healthy person, even if you have a binge of some sort with sugar, the body still knows how to take care of that and will still control how much is circulating in the bloodstream, how much gets to the brain for that reason. So it's not a problem. However, if this is a thing that is done all the time, yes, because it will end up leading to other health problems, can lead to issues with obesity and diabetes, then it will be a problem in that sense. Yes.
Let me ask this one related to diabetes. Can one have hypoglycemic seizures?
Yes, definitely.
And that's, just to clear it up, is when the sugar levels go so low that one gets a seizure, right?
Any sugar level that goes below 3.5 is deemed to be hypoglycemia.
Okay.
So how much, because we just explained now the brain wants glucose as its main food supply. It does not eat fat, it does not eat other nutrients, proteins, the like. It needs the body to know how to have glucose and have that glucose circulated to it through the bloodstream by the heart. In diabetes, we found that people can take their medication and not eat. The medication's job is to take the sugar level down. So that can be a problem, and then you end up, and even in non-diabetics, the body knows how to tell you your sugar is going low. First you get a headache. When you're hungry, that's one of the body's ways to tell you that your sugar levels are dropping. You start with hunger, then you get onto headaches. It can go on to, if you ignore it and you're getting low enough levels, in a healthy individual, again, the body will find ways to make glucose in the body by burning fat or doing other things. But where you've taken medication such as insulin injections in diabetes, or even the oral medication, now you've stopped the body's natural way of making sugar. Okay, and then what happens is, as it drops even lower, then you end up in a state of seizures, even coma, and a very low sugar can actually kill a person. So it is bad to have low glucose, can be extremely serious. Like anything below 1 can end up in permanent brain damage or even death.
So the moral of the story is that we must eat.
You must
Eat proper meals
healthily,
at regular intervals.
regular
And
intervals,
in moderation.
in moderation, everything in moderation again. Yes, and it's bad to be taking diabetes medicines
Without
and not
eating.
eat. Yes.
Yeah. Is it quite correct to say in non-diabetics a quick fix in the immediate vicinity of a seizure of a non-diabetic would be to give them sugar?
Yes, exactly, because that's what's lacking in their bloodstream at that time. So it can be sugar in the form of a cool drink. They're very high in sugar. Therefore, people should not be naturally, regularly drinking those. Okay, but that can be a quick fix. Chocolates and sweets, because now you need to elevate that sugar level quickly, or else the brain will suffer from it.
No, we know of partners of non-diabetics keeping sugars in their pockets
Yes.
because they know that it might help. But I suppose it's important for you not to just give anyone with seizures sweets. You know, it's not.
yes.
Yeah, that's why I say non-diabetic.
Non-diabetics,
Yes.
yeah, where
Okay.
it's known that they're prone to having hypoglycemic attacks. In that situation, I mean, there has to be long-term management of that. Discuss that with your treating doctor. So why is it that they have hypoglycemic attacks? You know, is it because they're over-medicated or something? They should be trying to find a balance between having too high a sugar or too low a sugar. So the medication must be there to try and balance things out.
So contrary to my own situation, it's important for people in their 50s to have partners that understand their medical conditions.
Yes,
Definitely.
definitely.
Yeah.
Yeah,
No,
definitely.
that's,
I'll work on that. I'll work on that.
it could be life-saving. Yeah.
Go ahead, naturally.
It could be life-saving. It could be
It's
life-saving.
true,
It could be
definitely.
life-saving.
I know I'm being attacked. Let's go to the next social media question. Is it true that if I am on epileptic medication, I need to be wary of contraceptives? Is there any relation there?
So there is definitely, there are medications that make the liver work too quickly. So the enzymes are too active because of the medication. Any other medication that you take now gets out quickly out of your system. Okay, so not just contraception, but even other medication, you can find that they are less effective because your liver is just too busy. Okay, so oral contraception can become less effective, and then that situation needs to be discussed even with a gynecologist about other forms of contraception. There are other ones that you can use that do not necessarily end up in your bloodstream, like in the implants, barrier contraception,
Oh,
and
yes.
other things.
Oh, yes.
Yes. But the important thing to note is that, yes, a person who's on epilepsy medication, there are times where they will be encouraged to be on contraception. We need the contraception when epilepsy is uncontrolled, okay? Because seizures can come and harm the mother who's pregnant and the unborn baby too. The medication can be harmful to the unborn child. So there are times where we need family planning on board while we try and control the situation and make sure that the medication that you're on is the safest, your epilepsy is controlled before trying to plan a pregnancy. So we need that you're not on medication and contraception that doesn't work because of the medication itself. So it's a thing that needs to be discussed with the doctors.
And maybe on the same notes, because I know like family planning, as you mentioned, and epilepsy can be quite a complex management thing for anyone. What happens when I want to fall pregnant, you know, and I'm on anti-epileptics? What options are available to me?
So there are medication that we should stay away from.
Yeah.
As any doctor who's prescribing for any women of childbearing age. So there's certain medications that are no for them, because sometimes people do fall pregnant without planning, and then it will be too late to do anything about that medication. However, if we're in a situation where the person plans and they discuss it with their doctor, the best situation to be in, they say, is to be using one type of drug, not multiple types of anti-epilepsy medication. at the lowest possible dose to control your seizures, and try to be controlled for at least 2 years. That is, in a perfect world, how things should be before we try for a pregnancy. Because while there are safer medication, not all of them are completely, there is absolutely nothing as completely safe for a fetus that's still forming. So there might be, I mean, a whole lot of people have children while they're epileptic, and children are fine and they're looking fine, but there is still a potential that it may still be harmful. So we try and get to the lowest controlling dose, or the lowest dose that control the seizures on one drug. If that's not possible, it's not possible, but that's the way we're going to go with what is deemed to be the safest option for any child that may be still developing. Yeah.
Okay. Yeah.
There's a question that asks if epilepsy can lead to memory loss, but I believe you said in the event of an epileptic attack, don't be surprised if the person doesn't have any memory of what just happened. But I think the question is referring to epilepsy affecting the brain in such a way that generally a person has bad short-term memory. Is that?
Yes, that's true.
Okay.
In uncontrolled epilepsy, so with every seizure that happens, there's damage on the brain.
Oh,
It may be damage that's not seen even on scans because of abnormal brain waves. So when those brain waves, you can imagine all of this activity that you're seeing on the body, what activity is happening in the brain itself. So on a molecular level, there is damage. And second to that is this recurrent falling and hitting the head, bumping the head. That's not good for ultimate brain health and function. So it can come from those two reasons. So even in a person who has seizures that you're not seeing, physically not seeing, by virtue of there being abnormal electrical brain activity, that can be damaging. And memory is one of the things that will be affected by it. The other can be even mental health and mental health disorders that can follow uncontrolled epilepsies. So people ending up with psychotic disorders because of that.
Just to make it practical, in terms of COVID, we're not trying to scare people out there, but just to be practical and relate things. Would a pandemic like COVID that leads to rampant respiratory and other viral complications or viral infections, would that lead to society experiencing more epileptic people in the future? Is there enough brain damage happening with things like a pandemic, like a COVID?
There's not necessarily studies that have looked into that specific question. However, how COVID can be a problem for people who already have epilepsy is the disease can get out of control. Whereas previously you were nicely controlled, COVID presents challenges onto the body, and now things are not in sync anymore. And the disease can now get out of control, you have more frequent seizures, and it can go haywire. So essentially, lack of oxygenation because of COVID disease is a problem for the brain, and then you end up with more frequent seizures. Fever itself, and the imbalances that happen in the body because of fever, your salts, hydration status, and all of that end up affecting the brain and leading to more seizures. But as to whether COVID can lead to more seizures in future, I've not seen any studies that would answer that specific question.
Okay. So, Doc, we're going to go through to your viral updates, and you should be worried. You need to live a very healthy lifestyle.
I do. Hey, I think we all do. But before we go there, I just wanted to ask, earlier on you mentioned Epilepsy SA. How accessible is that in our communities? Where does one go if they want to know more about epilepsy? And I'm talking to the most remote areas in South Africa, you know, in rural areas where they might not have access to such organizations. I know they do a bit of work, you know, in peripheral sites, but for somebody who's out there.
Okay, so a lot of information is available on the internet, and I do understand that that's not available to everyone. So the organization will be easily reachable through their website. But however,
It's still internet.
yeah. where you're in a place where none of that is available, the clinic, the local clinic is your next best source of information.
If it's functional.
No, obviously, yes. When there's a clinic, there are nurses. The nurses are your source of information. So people need to visit them, okay, and complain about this thing where it's been said that, no, it's just 1 or 2 seizures per month. That's not, that should not be accepted at all. We should, like I mentioned earlier, aiming for complete and total control. So if this is a school-going child, they can be in school full-time and not lose learning because of the seizures. If it's a person who's meant to be working, they can be fully, completely functional and economically active. Yes.
And I suppose one of the takeaways from this program is that one, that people shouldn't be accepting of certain situations. You should be knowing enough to say, no, I'd like to have it resolved as much as I can. Yeah.
Ask questions.
Ask your doctors.
See
what she did.
There we go. If you're in a primary healthcare setting, ask to be referred. There are other centers that wherever you are in South Africa, there is a way to be referred to a higher level of care, where maybe things can become clear as to why you're struggling with the disease.
Okay. Please think of one myth that you haven't mentioned. I know the one about objects in the mouth, and think about one truth that we want to amplify to the public while she goes viral. Talk to us. I believe there's a scare with monkeypox. And I know what was going on in the media, South African media, not only South African media, I believe even Africans in general had an uproar that why is it happening in Europe and we're only seeing African bodies displayed.
So yeah, it's been quite busy, you know, from our side as well. Just handling some of the questions that come through, but
you mean in your workplace?
In my workplace, yeah.
Okay.
But just to just share with everybody, you know, monkeypox is a condition, obviously, that is caused by a virus called monkeypox. It's not a new virus. It's been around for many years, as early as, you know, the 1970s. So monkeypox is closely related to smallpox. And I think when smallpox got eradicated, there was like an immune debt where there was decreasing or waning immunity to smallpox, and then there's an increased number of new people who have never been exposed to smallpox vaccine. We don't ordinarily see monkeypox outside of Western and Central Africa. So the big uproar is that we are seeing it now in countries that don't ordinarily see monkeypox. So we call them non-endemic countries. And what's even more interesting...
The uproar is that we need Caucasian pictures with showing the symptoms.
So the reason why we didn't have Caucasian pictures in the beginning is because in those areas they don't see monkeypox.
You're walking on thin ice for Twitter, Doc.
No, I'm trying to explain, and I
understand.
Yes, and I completely understand the discrimination that comes with it. There's a lot of discrimination with any new infection that pops up. It's often, there's subtleties in how it's displayed, either racial or gender biases. I think we're seeing that with monkeypox. The racial African, because it's ordinarily found in Central and Western African countries, but now we're at a stage where there is sufficient number of people in European countries where they should be displaying Caucasian pictures. We want Caucasian visuals. And also to steer away from, because now a lot of the cases are associated with men who have sex with men, that we steer away from any gender bias as well, to say that it is a disease that only affects a certain gender, which is not true. Yeah.
Okay, cool. Why is it called monkeypox, Doc?
Because it was first discovered in experimental monkeys in the laboratory, but now it's found in several animals, including monkeys, rats, squirrels. So it's not just monkeys.
When you say many years ago, don't include 70s there, but it's okay.
I'm sorry.
70s is just now, man.
Oh, okay.
Yeah.
Okay.
Tell us symptoms, common symptoms.
So it commonly presents with like a fever, you'd be tired, and there's a rash. And the rash is very interesting because initially it will resemble chickenpox, but the rash, and you get swollen glands as the other feature. So the rash, when it starts, may look like chickenpox, but it changes over the number of days. And with that change, it has a very unique rash, and you just know it once you've seen it, yeah.
Okay. One interesting fact about it, sorry for dwelling on it, is that if you sleep in bedding sheets that had fluids from monkeypox, that is infected with monkeypox virus, it may transmit to the next person that's sleeping in those sheets.
So spread from person to person is close contact,
Okay.
really.
Bodily fluids?
Not
necessarily?
it's not really been shown to spread that way unless it's like coughing and sneezing. It's the one mechanism, but very close contact, intimate contact, sometimes maybe sharing of utensils and bedding, but it's not necessarily the fluids that have been shown.
Okay.
Yeah.
So I shouldn't take my own bedding to the next hotel I'm going to sleep in?
No.
Okay, thank you. Doc, do you have any myths and truths that you want to help us? One each, please. One truth and one myth,
One
because
myth?
for the education of the public.
Yes. So I found that in villages, people with epilepsy, where people use open fires to cook, will say often that if a person falls into a fire, then they'll forever now be out of control. Like their epilepsy is completely going to go nuts, and they have frequent seizures. Okay?
Is that a truth or a
That's
myth?
not true.
Okay.
So the truth of the matter is the person was falling into the fire because they were uncontrolled to start with. And then what just carries on is the same thing they had before. So if they get the right medication, even after falling into a fire and burning themselves, they can still go on to get better controlled afterwards. It's just about the disease was completely uncontrolled before.
And the truth?
The truth is you can live a fully functional life. You can have your normal family, independence. Living with epilepsy does not equate disability.
Thank you, Doc. And once more, thank you for making the time. Thank you for bringing your insight and knowledge. And we gain all the time.
Again, all the time, yeah.
You're welcome, and thank you
Yeah.
again for having invited me.
Now, if some useful topics are to be continued beyond this platform, where do people find you?
People can find me on Twitter, on Instagram, and Facebook as Dimakatso Makwela MD.
Okay, you're on Twitter.
Yes, I am.
Very brave, doctor.
I've
got Twitter accounts that I have never posted anything.
I ever only focus on what's good for me.
Oh yes, you are clever. Because I have a weak heart, I also do not even read when people fight each other. Yeah. So if you also want to find her on our website, go to the tab that says Find a Doctor. There you will find all the practitioners that have been with us in the past and those that will be with us in the future. Sometimes consultations may be organized from the information that you can retrieve from there. And if you think our brands align with your brand and you would like to advertise on our platforms, please follow the lead email that is published on the screen here, or then go back again to our website and get in touch with us with the contact details that you will pick up from there. Or simply just drop us a DM, mostly on Instagram or Facebook. Anything from you, Doc?
Yeah, no, just thank you. This was very educational and insightful. So I really hope that there's awareness going forward on epilepsy. Yeah, thanks.
Thank you.
And if you want to be notified next time we have an episode, please don't forget to subscribe. Until next time, keep asking your doctors.